Hello, thank you all for coming back. My name is January Johnson. I am a community-based researcher for the Eye Care Project at Memory Keepers Medical Discovery Team. This podcast is sponsored by the Eye Care Project. And so I do want to let you all know that I did modify the topics and I combined a few together in this episode. And so in this episode, we'll be covering the topics of dementia, its risk factors, as well as the preventative measures. And so before we actually get into the presentation, I just want to let you know that my email address is located up on the upper left-hand side of the screen. So if you wanted to email me for any questions, or if you wanted, a copy of the PowerPoint, just shoot me a message and I'll get back to you. Okay, so we'll move along into this next slide then. So what causes dementia? And really, dementia is an umbrella term for, it just covers all different types of diseases that affects the person's memory, cognitive function, and behaviors that interfere with their everyday activities. And so there are many different types of dementia. There are 400 different types recognized worldwide. And in this slide here, we'll look at the common types of dementias. And this picture really does illustrate, dementia being an umbrella term, which covers all these, dementias below. And it really illustrates the variances between male and female. So I did get this idea from the Alzheimer's Association. However, I just modified it, to show those variances between male and female. Okay. So according to the 2020 census, 7 million people over the age of 65 have a dementia. And the leading cause of dementia is Alzheimer's disease, making up 60 to 80% of all dementia cases. It is also the leading cause of death in older adults. 32 out of 1,000 people ages 75 to 84 develop Alzheimer's disease each year. And 76 out of 1,000 people ages 85 and older develop Alzheimer's disease each year. Women are twice likely as getting Alzheimer's disease, meaning 2/3 of the people affected by it are women. Next, we have Lewy body, vascular, and frontotemporal dementia, which each make up 5 to 10% of all dementia cases, followed by others such as Huntington's disease and Parkinson's disease. And then below, we have mixed dementia, which is when someone experiences the occurrence of more than one dementia. From a study at National Institutes of Health conducted at a French specialized memory setting, there wasn't a significant variance in male or female rates of Lewy body dementia. 54.7% of all people with Lewy body dementia were female, according to a case study at another case study at the National Institutes of Health. Vascular dementia is most common in males. but has a higher gravity of impact in females. Um, and so women that do get vascular dementia have symptoms that are far greater than the males, um, are much more greatly affected or impacted by the symptoms. In another study, which looked at frontotemporal dementia not related to genetics, it was reported higher in males, making up 51.2% of all cases. Males also had an average of a 3-year earlier age of onset than females. And from the study conducted in a French setting, there wasn't much of a significant variance between male and females having Parkinson's disease. However, males made up 56.9% of all Parkinson's disease and have an earlier age of onset. Moving on to the next slide here, we'll look at the 4 main causes for developing Alzheimer's disease and related dementias, which include age-related changes in the brain, genetics, environmental factors, and lifestyle factors. And so these can be broken down into modifiable and non-modifiable risk factors, which we'll go over in the next few slides. First, we'll take a look at some non-modifiable risk factors. Age is what we have listed first here. So the risk factor for dementia rises as you age, especially after the age of 65. However, I do want to note dementia is not considered a normal part of aging, and dementia can occur in younger people as well. Next is genetics. People who inherit the APOE gene have an increased risk for the Alzheimer's disease, and the gene is also associated with an earlier age of disease onset. There are tests to determine whether or not you have that certain genetic mutation. And having a family history of dementia puts you at greater risk for developing the condition. However, many people with family history never develop symptoms, and many people without a family history do. Down syndrome is another non-modifiable risk factor. And so by middle age, many people with this condition develop early onset Alzheimer's disease. Next, we'll look at some of the modifiable risk factors. So managing your cardiovascular risk factors would be important. These include high blood pressure, high cholesterol, fatty buildup in your artery walls, and obesity. If you take care of your heart, you will lower your risk. Diet and vitamin deficiencies. Maintaining a healthy diet is important. Getting enough vitamins. People with low levels of vitamin D are more likely to develop Alzheimer's disease or related dementia. Physical activity. Lack of exercise increase the risk of developing dementia. Physical activity and social interaction may delay the onset of dementia and reduce its symptoms. Alcohol and substance abuse, which is known to make changes in the brain. Poorly controlled diabetes is another. So uncontrolled blood sugar, poorly controlled blood sugar levels can damage your blood vessels. And untreated depression is another. Late life depression may indicate the development of dementia. So it is important to manage the condition earlier when first noticing symptoms. Some additional modifiable risk factors are head trauma. People that experience head trauma have a greater risk of Alzheimer's disease. When taking part in activities that have an increased risk of head injury, wear a helmet. These activities can include like sports such as, boxing, football, baseball, even riding a bike. Um, Next, we have sleep disturbances, um, such as sleep apnea. It's important to treat your sleep apnea and talk to your doctor if you are waking up gasping for air. It really is important to get a good quality of sleep. Environmental pollution is another modifiable risk factor. So, increased carbon monoxide exposure, um, drinking water contaminated with mercury um, puts you at risk. Um, Smoking cigarettes, smoking may increase your risk of developing dementia and other blood vessel diseases. Next, we have hearing loss. Um, which leads to a greater chance of developing cognitive decline. So it's important to treat hearing problems early with the use of hearing aids, which may help decrease the risk of developing a dementia. Um, even medications that can worsen your memory. Um, so avoid taking sleeping tabs containing diphenhydramine. Also, be careful of drug interactions if taking multiple medications um, for any conditions. Just be sure to talk to your doctor or pharmacist. Um, Next, we'll take a look at some preventative measures. Um, things we can do to prevent some dementia or you know so we have keeping your brain active. Be a lifelong learner. Education plays an important role in preserving cognitive reserve. Um, Treat your health conditions, for instance, treating your high blood pressure, high cholesterol, and diabetes. Lose weight if you're overweight. See a doctor for treatment of depression or anxiety. Maintaining a healthy diet. One such as the Mediterranean diet, which is rich in fruit, veggies, whole grains, and omega-3 fatty acids. Like I had mentioned earlier, get enough vitamins. People with low levels of vitamin D are more likely to develop Alzheimer's disease and related dementia. Treat your hearing conditions. People with hearing loss have a greater chance of developing cognitive decline. Yeah, so it's important to treat your hearing loss early with the use of hearing aids. Be physically and socially active. Physical activity and social interaction may delay the onset of dementia and reduce its symptoms. So aim for at least 150 minutes of exercise weekly and get a good quality sleep. Um, Research has shown sleep plays an important role in memory and learning. Again, I mentioned previously, talk to your doctor if you snore loudly or have periods where you stop breathing or wake up gasping for air. Um, so yeah, treat your sleep apnea. Um, I think one of the key takeaways from this presentation is prevention, that good head and heart connection. What's good for your heart is good for your brain. I want to thank you for watching. In the next episode, we'll take a look at signs and symptoms of Alzheimer's disease and related dementias. In the next slide here, is just a list of references used for this episode. Thank you.